We know the opportunity, we know the potential for utility cost reduction in Ontario hospitals. We know how to do it because many of you have already shown us, and yet a tiny part of what's potential is actually taking place right now, and it makes no sense.
One of the things we find with greening healthcare is that the savings potential is so high. At $100 million in annual potential savings, $1 billion over 10 years, many people don't believe it. It's too high. We can't achieve that. It can't be real. Or they think that there's so much capital needed to achieve that it's not even worth going after. We'll never get the money to be able to do it.
And we achieved tremendous results. And I can tell you, it was at a time where we added 40 beds, so we were increasing, and yet we were saving dollars. Through the savings that Archie and his team brought forward, what we did is we hired another nurse.
So that really did make something tangible for the staff to see through energy savings, how they were able to increase their staff complement.
At the very start of the process, we had the vision, and then we created a plan. When you have the opportunity to build a new building, the ability to create a design that saves you money in the long term, 30 years or more, all gets directed back to patient care.
We need to understand that it's quality for the employees, for the staff, for everybody, and it's resources for clinical care. I'm in the healthcare business. Every dollar I save on energy resources, I put into healthcare.
We thought 40% was a bit atypical and a difficult target to achieve, but going through that process, we've learned that the benchmark could be pushed out further.
It's about continuous improvement in the hospital, working with your staff to find projects on an ongoing basis that make good business sense and getting them done.
And what we did is we started up a team of folks that really came together from all walks within the hospital. And they were directed through the board and through senior management, the CEO and senior management, to find efficiencies and to make sure we were the most efficient hospital we could be.
Who was the most interested? Who could bring some innovative ideas to the process? Who could help us achieve our goals? And we were shocked how many people have these ideas sitting with them, not knowing where to share them.
So people aren't alone. This is not just an issue for hospitals. This is an issue for society. And it's just a matter of getting the leadership to recognize it and drive that through their organizations by finding the champions that can get it done.